Hello, everyone. My name is Lala Jackson. I'm managing editor at Beyond Type 1, and today we're going to be talking about all things glucagon, including all of the new glucagon options. And if you don't know what I'm talking about, stick around. Today, we're joined by Dr. Segal. She is a pharmacist and knows everything you need to know about all of the new glucagon options. So I'm going to turn it over to her. Can you introduce yourself?
So I'm Alissa Segal. I'm a professor at the Massachusetts College of Pharmacy and Health Sciences, and a clinical pharmacist and diabetes educator at the Joslin Diabetes Center in Boston.
Awesome. Thank you so much for joining me today. Can you tell us first, what is glucagon?
So glucagon is a hormone that's secreted from the pancreas, similar to insulin. But what it does is in some ways opposite of what insulin does. So it causes the liver to release stored glucose when the body's glucose levels in the blood are low.
And can you tell me why it's important for people to have emergency glucagon on hand?
So it's important for someone to have glucagon available if they are on medications such as insulin, where they give themselves injections or they do inhalations of insulin, or they take medications such as in a group of medications called sulfonylureas, which cause the pancreas to actually push out more insulin. So because they then have insulin action in the body that either is from giving themselves insulin or a pill, they have the ability to have a low glucose level or a hypoglycemic episode. And sometimes our bodies don't effectively respond to hypoglycemia. For example, patients with type 1 diabetes may have an impaired ability to release glucagon from the pancreas, just like they may not be able to release insulin or may not be able to produce insulin. So it's important that they have that, especially if their glucose levels get really low and they're not able to consume carbohydrates to raise their glucose levels.
That brings me to my next question, which I think is really important. I've had type 1 diabetes for 24 years. I know I typically have my glucagon shoved away in a drawer somewhere. I don't ever really mention it to my friends or family who are around me. Why is it important for those of us who have diabetes to make sure the people we're spending time with also know how to use glucagon?
So typically, glucagon is going to be given when you're not able to give it to yourself. So it's when you can't consume carbohydrates. You may not be alert and oriented. You may actually be unconscious or having a seizure. You can't actually communicate with the individual who is with you at that time what they need to do. So that individual is also going to be, shall we say, freaked out a bit, because they're going to be faced with a situation that they are not used to and they don't want to be in, to be honest. Mm-hmm. So as prepared as you can, make all the individuals around you, whether it's a roommate or a partner, or by chance your child, if need be, or a coworker. It's important that other people know that you have a means of helping yourself and them helping you.
Definitely. I think one of the reasons I used to be so worried about showing people is that there used to only be one glucagon option. It was scary. It had a big needle. It was hard to use. I didn't like it. And then now with the new glucagon options available, they're all really easy to use. So can you go through the new glucagon options?
So there are technically 3 new options, but there's really actually 5 new ways. So one of the ways is an inhaler that is a nasal inhaler. It's a single spray into one nostril. It doesn't matter if you have a cold, allergies, it's absorbed in the capillaries right in your nostril. So it is just as effective as the old kit. So are these other options. But this one is no needles, right? The other options do have needles. Some of them happen to be hidden, which is also a benefit. So there are 2 pre-filled syringes and there are 2 auto-injectors. So by an auto-injector, I mean what is very similar to what more people are aware of, which is an EpiPen.
Mhm.
It's very similar to that, where literally you just put it up against the skin. There it is.
And it's
You
this
put it up
little,
against the skin and you depress it until that yellow area is all gone.
mhm.
Okay.
I was given these sample pens and they're so easy to use. I love it.
They're very easy to use. And that's really the big difference between these new formulations and the old formulation, where you had to actually take the what I call a diluent, but it's the solution that's available in the syringe to mix with the powder that's in the little vial. And then you have to redraw up the solution and then give an injection. I've even seen somebody, a medical professional, almost only give the liquid and not have actually reconstituted it in an emergency situation, because again, it wasn't a situation they were used to being in, and it was an emergency. They had a patient on the floor. So it's so important to have an easy way of doing things, or at least know how to use whatever device you have available.
Mhm.
Whether it's from sharing TikTok videos or YouTube, doesn't matter, or just even running through the instructions,
Yeah,
making sure the people around you know how to use whatever you have is
that's
important.
great. Yeah, I know. So that nasal spray is called Baqsimi, and it's from a company called Lilly. And I know when I first got my Baqsimi prescription, I went on my Instagram stories and I was like, hey, everybody I know, this is the thing that's in my bag and this is how you use it. And I'm lucky that I have not yet had that kind of severe low where I needed assistance, but it's such a great peace of mind to know that I've already told everyone how to use it. Many people ask me about it now, which is so nice that they're concerned and they want to be able to help if something comes up. And it's such an easy option that I'm not scared about them doing something wrong. I know that it's simple enough that even if people are not used to using needles or not used to doing anything, they can do the auto injector or they can do the nasal spray, and it just makes things so much easier.
Or afraid of needles.
Yeah.
We tend to downplay that when we're so used to giving injections or inserting, our infusion sets.
Mhm.
But that can be really intimidating to somebody who isn't exposed. They're not a medical professional. They haven't been around this for years. It can be really scary, besides the fact of the situation that they're in right now.
Yeah.
Now, I will say the one thing about the nasal spray is to remind people not to spray it before they get it in your nose. Unlike allergy nasal sprays, you don't, what we call prime it. So you don't spray it before you actually use it. It only has one use. If you spray it into the air, you spray the glucagon into the air.
Yeah.
We need the glucagon into the body, not into the air.
That's a really good point. And that brings up another thing I was thinking about. You mentioned a few times as we were chatting about before this video of the different times where glucagon might not work the way we think it's going to work. Can you go through some of those times?
So remember that glucagon only allows the liver to release the stored glucose that it has stored and is available. So there are times when the liver doesn't function the way we want it to. One situation might be when somebody's had a few drinks. And if you've had a few drinks, your liver has had a few drinks. So think about the fact that your liver is slowed down and may be sluggish to respond, and therefore it isn't going to respond in the urgency that we want it to respond.
Mm-hmm.
So that would be one situation. Another situation is actually after intense exercise, because you may have used up your stores of glucose and not have any left to use. That's why it's actually important to make sure you actually replace your stores. But if you have a low after exercise, you may not actually be able to use glucagon to respond. You may need to actually call emergency services and get some glucose actually injected rather than have glucagon. Also, actually, older adults don't tend to have as much stored glucose in their livers, so they might not respond to the same extent. And they may also not be able to sense their glucose is low, either because of medications that they take. And this could be true even not if they're older, but Different medications they take can change their ability to sense their glucose levels.
Mhm.
And also, depending if their glucose is low, they may be confused, right? And then may not know how to communicate what's going on.
Yeah.
So I've actually had students of mine describe situations where they were working in a pharmacy and they thought that somebody came in and they were actually drunk, but they actually were having a hypoglycemic episode. And luckily the pharmacist noticed that they were somebody that was on insulin and checked their glucose level and was able to help the patient. So it is also something that might be confused with actually somebody acting as if they're intoxicated.
Mm-hmm. Yeah, that's always scary for sure. What is another concern or something to think about for people who have given glucagon? Are there different things people need to be aware of or something that might happen after someone gets a glucagon injection or nasal spray?
So one thing that's important to know is glucagon can cause nausea. So it's the top adverse effect for every single one of these new formulations and old formulations. So if you think about when it's recommended to give glucagon, usually the person is going to be laying down. Well, if they get nauseous or if they vomit and they are laying on their back, they actually may breathe that in and choke. So you want to make sure, just in case, not that I want anybody to vomit, but just in case, that they are laying on their side and they do not actually experience, have that situation occur.
Mm-hmm.
So, so that is quite important to just kind of shift them to their side so they're not laying on their back.
That sounds good. So to recap, we need to make sure we know that it might act a little bit differently if we're of older age, if we've just exercised, or if we've consumed a few drinks. And we need to make sure that the people around us know where we're keeping our glucagon, how to use it, however way we want to explain that to them, and to turn us over on our sides if they've administered it. Okay.
Exactly.
And then the last thing I wanted to cover is cost. I know that's been a major issue for a lot of people. The older glucagon option is sometimes prohibitively expensive, but also sometimes that's the one that's really well covered. We do have a lot of new options right now. So the different companies are really trying to make sure it's accessible for people. What's the number one thing or what's the best thing for people to do if they're wondering about cost or think they might need some help with cost there?
So I would suggest that they look at the different websites for the different companies that make the different products. Often you can see the different support options. Some people may qualify for some and not for others. And if you have questions, you can even ask your pharmacist, your local pharmacist. They might be able to help you navigate those different options. But that would be the first step, would be to go to those websites, because they've made them much easier to navigate and show you what you might or might not qualify for.
That's so good to know. Thank you so much for your time today. I know the world of glucagon can be scary for people. It's a thing that they don't want to think about. Of course, we don't want to think about having a really scary low, but that's exactly why it's so important to be prepared and know our options. So I really appreciate it. Is there any last things that you want to make sure people are thinking about in terms of glucagon?
I would just, even if you've never had a low, really consider having a glucagon kit. And as much as maybe somebody likes to call EMS and see the, workers come in, I can't tell you how often I have a partner tell me that, it is not something they really want. And it is very scary for them should they ever experience it. So having that conversation, and acknowledging that you're scared, but also that you are aware that this is a situation that you are doing everything you can to make sure that doesn't happen, but you want them to be prepared just in case.
Definitely. Thank you. I really appreciate it. And I know our community appreciates it as well.
It's my pleasure.